communities, and we're not going to have that. We're taking great care of them. With the Rural Health Transformation Program, we are getting rural communities the health support they need, and we're getting it immediately. These funds will go to empowering rural hospitals, strengthening their workforce, modernizing facilities and technology, and ensuring that rural Americans get world-class health care in their own community, right smack in their own community, like they've never had it before, and they've been hurt very badly by the Unaffordable Care Act. Every single Democrat in Congress voted against the lifeline for rural communities, and I hope everyone knows this, and this is not about elections, but I hope you remember this in the midterms, because the Democrats are just so horrible toward the rural community. But I want to take a moment to thank the incredible House and Senate Republicans who worked so hard on making this historic investment possible. That's what they did, and they did work hard. I don't think, got a Democrat vote, did we? Did we get one Democrat vote? We got all Republican votes. It was an amazing feat, and I want to thank Mike, our Speaker of the House, Mike Johnson, and John Thune for really doing a great job. It was tough. You know, we have small majorities, and I want to thank the congressmen that are here for doing, in particular, for working so hard and getting this done. Yesterday, I also announced our framework to lower health care prices for all Americans, including those in rural America. And we're calling it the Great Health Care Plan. You know, we had to come up with a name, and everybody wanted to say, oh, well, can we put something about lowering costs, because we're lowering costs very substantially. So I had Bobby, and I had Oz. We had everybody in there. We had a whole group of people who were trying to come up with, so we're saying, the cost reduction plan that gives you good health care. And I said, it's too long. It's not going to sell. I said, we had more plans. And they wanted to get the words cost reduction in there, Laura, especially you. They wanted cost reduction in, and then they wanted great health care in. I said, look, you can have one or the other, but it gets too long. We're talking about the name of a plan. So we got it down to 7 or 8 words, and which is far too long. Nobody can remember that much. And I said, how about just call it, because this is the Great Health Care Plan. Now, a great plan has to be cost-effective, otherwise it can't be a great plan. That's the way I looked at it. So we have a very glamorous name. It's called the Great Health Care Plan, not the Unaffordable Care Act. I don't like that name. This is called officially the Great Health Care Plan. That means low price and great health care. So you're going to have, at a lower price, great health care. First, our proposal codifies the massive discounts on prescription drugs that my administration is achieving through our most favored nation provisions. Okay, we can go into this. We can go into this for hours, but the bottom line is we'll be paying the lowest price of any nation in the world. Whoever's paying the lowest, we match it. This could have been done years ago. I was going to do it in my first administration, but when COVID came toward the end, I said, I can't believe it wasn't exactly a good time to be doing it. But I said, why isn't somebody doing it? And the reason they're not doing it is that no other nation would agree. France, as an example, paid 10% of what we paid. Germany was paying 13 or 14% what we paid. In other words, we paid many times more, not a little bit more, not 10% more, 10 times more. A pill would cost 10 times more in New York than it would cost in London, as an example, than it would cost in Munich. And this went on for many decades. This was right from the beginning. And the reason it went on was a little bit of the healthcare companies, but it was other nations. And I understand that. If I were heading Germany, I'm not going to double and triple and quadruple my healthcare. They got the healthcare companies to pay. It just took place over a long period of time, got worse and worse, and it just hit numbers that were just absolutely unsaleable. And if you remember, the doctors in the audience remember this, say, well, we have to do research and development. I said, well, what about research and development for Germany? Well, we've decided to put up so the pill would cost 5 times more because of research and development, and 5 times more for other reasons.